Hi, my name is Kim Ambrose. I believe most of you know me from the gym. I hope everybody is well and you guys are all doing great. We are going to be going through a CPR lecture today and showing you some practical skills on what to do in case of a cardiac emergency. So this is not a certification class. This would be like the class that you would have if you were a coach or a teacher at a school. This is definitely not a class that a nurse or a doctor would take. That is more of a professional class, and I can teach that class. We'll talk about that at the end. But what I would like to go over first is we are doing this at Critical Mass, and I wanted to show you Critical Mass's equipment that they have here in case of a cardiac event, okay? So they are prepared with an AED, and an AED is an automatic external defibrillator, and this is what you use in case somebody is having a cardiac episode where their heart is beating incorrectly, and it's due to an electrical issue with their heart. And this AED, which all they have to do is turn it on and follow the instructions, will shock the heart and stop the irregular activity so that the heart will hopefully start back up in its normal regular beat, okay? They have this here, and in their first aid kit they have aspirin, which also we will discuss about a cardiac event, okay? So the signs and symptoms of somebody in cardiac distress: you have the classic symptoms of crushing chest pain, feels like maybe an elephant sitting on your chest, or indigestion. That can be very, very common. What happens mostly with men. They also will have a weird pain that radiates out to their left arm and sometimes up to their jaw. Women, on the other hand, can have those classic symptoms, but they can also have pain that goes across the back of their shoulders. And there's a little more of a hormonal thing where they feel like there's an impending sense of doom, or they feel like something horrible is going to happen. So women that have survived cardiac events, when they've talked to them afterwards, they have said these things. So in the days that preceded this event, those were the symptoms that they had. They felt like something was going to go horribly wrong, and they had this weird pain going from shoulder to shoulder. Excuse me. And in that instance, had somebody recognized the symptoms, they probably wouldn't have gone into full cardiac arrest. They would have been able to take aspirin or go to their doctor or go to the hospital and be treated for whatever was causing those symptoms. We're going to talk a little bit about aspirin. Aspirin is given to somebody who is conscious and alert, over the age of 19, and has no issues with taking aspirin. They're not allergic to it, they don't have any stomach ulcers or bleeding issues, and their doctor has never told them that they couldn't take aspirin. So what aspirin does is it makes your platelets less sticky. So if you are having a cardiac event and there is an artery that is closing up due to a block, the aspirin will make the platelets less sticky and the blood be able to slide through that clot and get to the other side to oxygenate the heart better. The aspirin that you would take is either 4 baby aspirin or 1 full-strength aspirin. You would chew that, hold it under your tongue for a little while, let it dissolve, and then you can take a sip of water and swallow it. People that have had issues where they have pain due to a cardiac event and have taken aspirin have described on a scale of 1 to 10, 10 being the worst pain, the pain level decreasing from a 10 to about a 6 after taking aspirin and 5 minutes goes by. So we highly recommend, and the hospital, it's one of the first questions the hospital will ask when you get a cardiac patient there, is whether they have taken the aspirin yet or not, because they will then administer it if you haven't. So, and Critical Mass has it here. We have talked to these guys about recognizing the signs and symptoms of a cardiac event, and they are well prepared in case something happens, okay? So if something does happen, we want to make sure that you automatically call 911. You want to make sure that an ambulance is on the way, help is on the way. Most police officers are trained in CPR and AED, so they carry an AED with them. Here in Tinton Falls during the day, they're paid. You have a paid staff that would show up if you called 911 from critical mass, and at night it's volunteer. So you have help, and their police officers in Tinton Falls are all trained as well.